Hi, my name is Sakur, and I am reflecting on my session with Simon, who's a 19-year-old university student who had a doctor's referral um, regarding his anxiety. Simon was able to, during the session, identify what it was that he wanted to achieve, was essentially being confident enough to ask a girl out. The contracting part of the session went well, in the sense we were able to move through all the obligatory regulations and limitations to confidentiality. I think I provided Simon with some factual, clear information when he wanted access to me outside of sessions, and the reason why that's not possible, and also the fact that it's a professional relationship and that I'm there to help him and to talk through issues, but I'm not there um, on a 24-hour basis, just as his lecturers are not. I think he understood that, which, is important in building an ethical and transparent relationship with clients. So I think that was good. One of the strengths of the session was my use of scaling questions. I think I was able to support Simon in articulating how he felt towards the end of the session in terms of confidence. Inside the session, he felt that he was an 8, and then he noticed that, he felt like when he left the session, he was going to just drop back down to a 2. And we were able to talk about that and why that happens, and that's quite normal, that when you're in a safe space. So I think he understood that, and that we were able to explore that a bit further, and help him articulate, hopefully, that into action after the session, in terms of going out to ask Nina out for coffee. And I think that whole part of the session helped him feel like he was ready to take action. However, similar to other sessions, my tendency to interrupt or not wait till someone's fully finished talking and start to talk over the top of people is an issue. There were moments where I didn't fully allow Simon a chance to finish his thoughts before responding, which probably limited the depths of his responses. So it might have impacted on being able to sit in the moment with his feelings, but also be able to explain to me exactly what he was feeling. So I really need to work on that. I also felt that I was a little bit rushed in my delivery in explaining the breathing techniques and the physiological benefits of using the breathing techniques, and also other techniques like pushing your feet into the floor and releasing, just to reset your nervous system. And I should have really slowed that down and allowed Simon to really understand, because he's a chem student, what the physiological effects are and why you use it. And then I think that would have given him more confidence in terms of learning when to use it outside of session. So that's something I'll have to look at revisiting. I think for me, it's just improving my listening skills, slowing things down, and allowing comfortable silences and being okay with that. I find it interesting, actually, that in my cross-cultural life, I find it much easier to sit in silence and much easier to wait for people to speak. However, in what I would term mainstream life, I tend to want to fill in the spaces or interrupt a lot more, and I'm not really sure why that is, but I will be discussing it with my supervisor next week, to maybe unpack some of that. It may be just because I'm more comfortable in my own culture, because perhaps I understand the rules, or understood the rules better as a child and a teenager than I did the mainstream and non First Nation ways of communicating. So that's something for me to work on. Overall, though, I think the session had good solid structure. I used some good techniques, and I just need to work on pacing and depth.